Hey there, Todd Cameron here, GP and Medical Director at M3 Health. Today I want to chat to you about the changes to the telehealth item numbers that the Federal Minister for Health, Greg Hunt, has brought in as of Monday, the 20th of July. Now, these changes do not affect those in the metropolitan Melbourne lockdown yet, and they will come into effect at the end of the lockdown, but they will affect you if you have been enjoying telehealth consultations, and I'm going to explain to you exactly why. So the reason they made these changes was that there were a fair few organisations that had set up telehealth only businesses, so they were not able to offer you face-to-face consults, and therefore continuity of care wasn't guaranteed. So we know that the greatest value for seeing your GP is having a home GP, your usual doctor, what we might have called our family doctor back in the day, and a clinic that is your home clinic. So if that doctor's not around, you would be able to see one of the other doctors. They'd have access to your files. So it's just about longitudinal care. The longer you have a relationship with your GP, the better you're likely to do with your health. In fact, if you're going to do one thing only for your health, choosing a GP that you stick with for some time is probably the single most important thing that you can do, and there's a lot of evidence to back that up. So the government made a decision to make it hard for people that weren't committed to providing continuity of care for patients, and so they changed the rules such that you can only access the telehealth MBS item numbers if you have seen either the doctor or the practice for a face-to-face consultation in the prior 12 months. So we're going to make sure that we contact the patients on our appointment books that have seen us that have consulted over telehealth, and at the moment with us that's pretty well telephones only because it's simpler, faster, more effective and more reliable than trying video. And we do run a special assessment clinic, so in the event that you need a face-to-face consultation, that might be immunisations, it might be having an IUD inserted, it might be having a skin procedure, it might be having an iron infusion or a child vaccination. Any of those things can currently take place in our special assessment clinic, and that is run like a well-oiled machine. So the doctor is in full PPE, so you are safe as the patient. The waiting room numbers are dramatically lower than what you'd normally expect. Appropriate social distancing in that space. Obviously, all patients at the moment in Melbourne would have masks on, and all surfaces are decontaminated in between consultations. So it is a very safe environment for you to be seen, and that is the only place we will be conducting face-to-face consultations. We call that the orange zone, the special assessment clinic. And so all of our patients that need a face-to-face consultation will shortly be contacted by our team and invited in for a face-to-face consultation. At that time, we will make sure that we address all of the ideal and appropriate preventative health interventions for you. We'll make sure that we take all of the appropriate measurements at that time, and then you'll be able to enjoy the MBS rebates for telehealth for the foreseeable future. And at this point in time, you will know that at M3 Health, we will continue to bulk bill telehealth item numbers for now, just as our way of giving back to the community during the pandemic. Thanks. I've been Todd Cameron. Bye.